It started as a small, harmless-looking pimple on his neck. He thought it would disappear in a few days. But within a week, it began to move. What doctors found inside left the entire hospital in shock. This is the story of Arif, a 32-year-old man from Malaysia. He worked long hours in front of a computer, often ignoring small health issues. One morning, he noticed a red bump just below his ear. It was painful, but he brushed it off, thinking, "It's just a pimple." Days passed, and the bump grew larger, hot, swollen, and throbbing. By the fourth day, it had become the size of a grape. Arif tried everything: warm cloths, antiseptic cream, even painkillers. But nothing helped. That night, while pressing the bump, he felt something strange, a slight movement beneath his skin, a crawling sensation. His heart raced. That's when he realized this was no ordinary pimple. He rushed to the emergency clinic the next morning. The doctor examined the swelling carefully. It didn't look like a normal abscess. Instead of pus, there seemed to be a small tunnel beneath the skin. The doctor frowned and ordered an ultrasound. As the probe moved across Arif's neck, the screen showed something incredible. Faint movement inside the bump. Something was alive. The medical team suspected a rare case of myiasis caused by the larva of a botfly. These tropical flies lay their eggs on human skin, and once hatched, the larvae burrow deep, feeding on tissue for days or even weeks. Arif was taken to the procedure room. Local anesthesia was given. Everyone watched as the surgeon made a small incision. For a moment, nothing happened. Then, slowly, a white larva began to emerge, wriggling and alive. Gasps filled the room. The creature, almost an inch long, had been living beneath his skin, feeding on his tissue. The doctor carefully pulled it out with forceps and placed it in a tray. It was still moving. The wound was cleaned, disinfected, and covered with a sterile dressing. Arif finally breathed in relief, shocked but grateful. The doctors explained that he must have been bitten by a tropical fly during a hiking trip a few weeks earlier. The eggs likely entered through the tiny bite wound and developed unnoticed until it caused pain. After a few days of antibiotics and rest, the swelling vanished completely. The scar faded, and Arif returned to work, wiser than before. He now warns others: never underestimate even the smallest bump or bite. What seems like a simple pimple might hide something far more dangerous. Always listen to your body. Small symptoms can reveal big truths.